Doctor, what is fresh embryo transfer?
A fresh embryo transfer is a medical procedure that is performed during in vitro fertilization to transfer an embryo which is recently fertilized into the womb or the uterus. During an IVF cycle, multiple eggs are retrieved from the woman's ovaries and fertilized with sperm in the laboratory setting. The resulting embryos are typically allowed to grow in the laboratory for 3 to 5 days, and especially in Krishna IVF, we use time-lapse technology to do uninterrupted culture conditions and monitor them before they are being selected to be transferred into the woman's uterus. Other places, they check the embryos at 24, 48 and 72 hours. So the information is adequate. The information that is obtained from time lapse is vastly different and superior. When we come to an embryo transfer, a fresh embryo transfer is typically done when the embryos are at the 4th day at the compacted or blastocyst after fertilization. What is blastocyst? The blastocyst embryo has developed into a ball of cells and is ready to implant into the uterus, and these embryos are transferred into the uterus using a thin flexible tube called embryo transfer catheter, which is inserted through the cervix. The success rate of a fresh embryo transfer can vary depending on a variety of factors. The factors include the age and health of the individual, the quality of the embryo, the skill and experience of the embryo transfer physician and the fertility clinic. All these factors are important in having a good outcome in all assisted reproductive procedures.